Okay, well, it's just past 11 a.m. Good morning, everyone. I'm Tamara Ecker, Executive Director of British American Business here in New York. It's my pleasure to welcome you to today's session, which is actually the first of a three-part series, Putting People First. Today's session will focus on how to support a workforce that stays strong, compliant, and productive. Next week's session will focus on leading during a crisis, followed by a session on how to adapt global mobility programs in the new normal. This People series covers important topics for all employers, and we are very grateful for the support of Invest Northern Ireland, who have made this series possible. As the regional business development agency, Invest NI's role is to grow the local economy. They do this by helping new and existing businesses compete internationally and by attracting new investment to Northern Ireland. As part of the Department for the Economy, Invest NI provides strong government support for business. And as the US and UK have now begun negotiations for a trade deal, now may indeed be an interesting time to explore the UK for your business. So, it's great to have you all with us, and now it is a privilege for me to introduce you to our facilitator today, Bruce Millman, New York office managing shareholder at Littler. With more than 40 years of experience counseling private and public sector companies on business and personnel strategies, Bruce works with employers on labor and employment aspects of mergers and acquisitions, discrimination and family leave issues, personnel policies, and the list goes on. Bruce is a frequent lecturer for a wide range of organizations, and we're very lucky to have him with us today. Bruce, over to you.
Thank you so much, Tamara, and thank you to all of you who are attending our presentation today. I'm going to start with some house rules. We will spend about 35 or 40 minutes or so in a discussion with our presenters, who will introduce themselves very soon. And then we will use the rest of the time for questions and answers. There is a Q&A feature at the bottom of your screen, which I hope you will use to submit questions to the panelists. We will try to answer those questions as we go along. And also, as I said, we will have some opportunity for questions and answers at the end of the program. Meanwhile, you are on mute, so I'm afraid you will not be able to shout out the way you might in school. We again use the question and answer feature at the bottom of your program. This session is being recorded and can be shared upon request. If you would just write to Tamara or to Holly Lou at British American Business, I'm sure they would be happy to send you a link to the program. Our topic today is your workforce staying strong and compliant and productive. But of course, we're not talking about just any workforce. We're talking about your workforce in the era of COVID-19. The coronavirus pandemic and its economic consequences have presented employers with challenges that are unprecedented in their scope and in their array. On the one hand, we have shutdowns, layoffs, furloughs, pay and time reductions, associated notice requirements, unemployment issues, and work-share programs. These are the issues that I personally deal with primarily in my own practice. On the other hand, we have remote work and all its challenges for supervision, engagement, collaboration, and compliance, which is to say nothing of the myriad new sick leave and family leave laws and benefits issues that you're all facing. And then we have issues of medical information and privacy to contend with. And at the same time, what do we do about reopening? How are we planning for reopening? What are we going to do? When are we going to do it? Who are we going to bring back? Is sex harassment still an issue, or has that disappeared because of the pandemic? And what about our diversity and inclusion efforts? Do we have to ignore those while we're concentrating on all of these other pressing matters? We could spend days talking about these topics in depth, but we don't have days, we just have an hour or so. But we have two wonderfully knowledgeable and thoughtful leaders to guide our discussion today, Devjani Mishra and Kiabi Carson, and I'm going to let them introduce themselves. Devjani?
Thanks, Bruce. Good morning, everyone, and thanks for joining us. My name is Debjani Mishra. I'm a shareholder in the New York City office of Littler, currently broadcasting from elsewhere, not in New York City. And I have, for the last 3 months or so, feels a little longer, probably feels longer to you, have been working on Littler's task force for responding to issues related to coronavirus, and currently I'm working on our return to work efforts. So, taking all the lessons that we've learned working with employers all throughout their response planning, and now refocusing that to bring folks back to work, help clients think about, their challenges in terms of returning to work. Kiabi?
Great, thanks, Debjani. Hi, everyone. I'm Kiabi Carson, and thank you again for being with us this morning. If you're on the East Coast, it's probably a little bit earlier in other locations. But I have had the responsibility for the last 8 years of leading human resources for the North American region for Turner & Townsend. And so for those of you who may not be familiar, Turner & Townsend is a independent professional services company, and we specialize in program, project, and cost management consulting. And so I lead the HR team across the US and Canada functions, which oversees 1,000 employees, but globally we're about 6,000. Thank you.
So let's get started. Debjani, I have a question. Could you tell me what you've been hearing or seeing from clients on the employment law side? What are their pain points that they're experiencing right now in the crisis?
Sure, and I think you alluded to a lot of them, and it really depends on who you are. For some businesses that are relatively able to have people working remotely, we are seeing that many of them plan to do so for quite some time. We keep hearing about clients, particularly in the tech side or the financial industry, who have very long timetables to come back to work, and their pain points are mostly around how to work remotely, how to support that work. We've got all the way at the other end of it, clients whose business model is challenged existentially when they no longer can interact with their customers face to face, on the hospitality side, on the retail side, clients who are really being forced to think about the work and the product in a way that they never have before. What does the retail experience look like when people cannot easily try on clothes? Because there's no good way to fumigate all of your products. What does the restaurant experience look like when you have to think about, reducing the number of tables? And so it's a wide range. At the early part of this crisis, we saw kind of the dilemma of how do we shut down? How do we take people out of the workplace? These days, I think what clients are really struggling with is the fact that, at least here in the US, we have almost every state and many localities within states constantly putting out guidance, and each set of guidance is a little bit different. And so if you happen to be an employer that only works in one location, you're probably not tuning in for this webinar. But if you have employees in multiple locations, you may have a real range in terms of what state and local governments are telling you, as far as, here's what you need to do to work safely, or here are the distancing measures you need to apply in your workplace. Here are the symptoms. No, these are the symptoms. And so reconciling all of those and trying to come up with a coherent plan for when can we get back to work? How can we get back to work? And then what do we do if someone becomes sick? How do we manage that? And again, those are things that really, those industries that have been able to stay open, the essential industries, have been dealing with that all along. I think for those of us who work in the employment law HR space, it's almost daily or multiple times a day that we get new legal requirements that come online, that we try to push out the information onto all of you. But it really, I think no matter where you're situated in this, there are pain points for you. And it's just a question of accurately identifying where they are.
Kiabi, does that resonate with you? What kinds of things are you seeing in the workplace?
Yeah, definitely, Bruce. I think, a come to your point, Johnny, in the beginning of the crisis, it was about cost containment strategies. Your revenues being impacted. How do you contain costs so you preserve as many jobs for your workers as you can? And then think about what does that look like when we come out of recovery? And are you going to be, prepared or positioned to do that? Fast forward 8 weeks later, we're now all focused on, return to offices, return to work. And for our organization, it's a bit unique because return to work means return not just to our offices, but to client offices or to construction sites or job sites. And so really understanding when you think about the safety of your worker and what does that mean, we have to balance between our own locations as well as locations that we don't necessarily have control over, but we have to make sure they're safe for our employees to return to. So that's really where our focus, we spent most of our time. I think we've come up as an organization with a really good plan of attack of how we're going to do it, but that's really where our focus is right now, is how do you return people back safely?
Let me ask you a question, Kiabi. There are a host of new laws involving sick leave and leave of absence.
Yeah.
We have in New York, we have, of course, the FCCRA. We have the expansion of the New York City safe and sick leave law. We have the state COVID sick leave. We have in some cities, the West Coast, of course, many FCCRAs.
Yep.
How do you deal with that? I mean, that seems to be a real challenge to me.
Definitely. So for the longest time, we were dealing with that internally, Bruce, where, our payroll and benefits team would really work to manage, what are people's leave entitlements, notifications to employees, making sure we're keeping track of that, working with our brokers to quite honestly to help us understand where our state laws beginning to change. And it's not just state, there's the federal, there's state, there's local municipalities. I mean, we have a large contingent in San Francisco as a great example when you think about kind of local laws. And so we did that for a good majority of time, but we're at a place now where it's too complex. It's ever changing. I think COVID has added even more complexity. So we've made the decision about 2 months ago to outsource that leave administration to a third party. So we're now partnering with our disability and insurance administrator. They are taking on leave administration, which is another area of expertise for them, to take that from us and really to manage it to make sure we can stay in compliance. So we're doing that transition now. It'll be effective in July. But that's where we thought was going to be the best path forward to really make sure we're staying on top of it.
Devjani, what recommendations are you making to clients with regard to all of these leave laws they have to comply with now?
Sure. I mean, Kiabi hit on a really good point, which is even if you are in a place where you're lucky enough to have a leave management team, and I was in-house for many years and I was more or less staple to my leave management team because they can be the most important people on your team. But no matter how good they are or how robust they are, the current situation is a challenge because the law does change all the time. And it's not just that there are more kinds of laws, but that they work differently. And so if you were very used to the old family medical leave law, which has certain requirements for documentation, the new federal law is different. Who it applies to is different. What you can use it for is different. And so, keeping your leave management team on top of that is important. The other piece of this is, especially because a lot of companies are going to have a lot of folks working remotely, it may be that your on-site supervisors who normally don't deal with leave issues are the ones who are getting the most immediate information about what's going on. And so you've got to get some information to them so they know how to respond appropriately. Because if you have an employee who's been exposed or who's confirmed, your priority should be getting that person out of the workplace. And there may or may not be a leave set up to do that, or your supervisors may not know how to do that. But one piece of federal guidance that we still have as of 11/15 on Tuesday is that the CDC regards having leave available as part of your safety plan, giving an employee the option to get out. And so, that's an issue. There's also a different kind of issue here, which is fundamentally, this is a medical situation. And so we're seeing employees who are raising medical concerns about coming back to work on the grounds, either that they have continuing health effects or that they may be at higher risk of serious complications if they get COVID-19. And the EEOC issued some guidance towards the end of last week in terms of how to accommodate those people. And if remote work is not an option, you may have to look at providing a leave of absence to those employees. And because so many of us are working remotely, it's harder to argue that remote work is not an option in the way that we might have it this time last year. So those are big. I think the other piece is, even as the states are reopening, the schools are not. And so you are going to have employees who have childcare issues, don't have a place to put their children during the workday. And many parents are struggling to manage all their obligations. The new FFCRA, which applies to companies with fewer than 500 employees, provides some childcare leave options, but it's a new law. People don't necessarily know as much about it as they should or how to apply it. And again, you know, if you think about the scalability, many of your employees are going to be in the same situation as far as their kids' schools are concerned. So more than enough to keep Kiabi's entire team running 36 hours of every 24.
Yeah, definitely.
Yeah, but you're seeing the same thing, I assume.
Yeah, definitely. I think the point that you made, Johnny, that I think that I've had a lot of conversations with our leaders to understand, I think when we're talking about COVID and the whole focus is around, you know, if someone's positive or is it a medical issue? And I think your point is valid, that it's well beyond that. It could be the child care situation. It could be medical. It could be, I live with someone who's immunocompromised and therefore I'm concerned that I may, you know, bring something home. And I think as employers, we have to think more broadly than just that particular issue of COVID. I think COVID has impacts across a lot of different areas. And so I'm saying, have the conversation. You know, if someone's saying, I'm unable to return to the office, have a conversation to understand how can you accommodate them? Because in a lot of cases, you can do remote work. In cases where you can't, then you need to have a dialogue around it versus saying, well, if it's not COVID related, then that's it. We can't support it.
I'd like to get back to that question a little bit later about the issue of bringing employees back to work and their reasons for not coming back to work. But before we get to the back to work issue, I have another question, Kiabi, that I think you might be in a better position to answer than Devjani, and that is, you know, there's traditionally been a fear that remote workers are less productive than those who work in an office. I don't know whether that's true or not, but are you finding that? And what is Turner and Townsend doing to keep employees engaged and to maintain morale and maintain their productivity while they're all working at home?
So I'm glad you asked, Bruce. So no, we have not found that at all. In fact, we have found our employees are even more productive than they have been, you know, kind of commuting into an office, given the fact that we commute, we have travel. You know, there are some distractions you get, of course, in the office when you're with other workers. So with everyone remote, our productivity has been probably the highest it's ever been. So we have not found that. I think the challenge that we do find is that employees are finding it more difficult to know when to turn it off. Because when I'm home and I'm sitting at my dining room table, or I'm, you know, in my office, if I have that opportunity, it's easy just to keep going. Most of us talk about, we kind of start in the morning and 8 hours later, you look up, you're still sitting in the same place, cranking out work. So I think we're finding the opposite issue of how do you help people to find better work-life balance while they're working at home? Because I would argue they probably had it even to a greater extent when they were in an office. So that's where our conversations have been quite a bit as an employer of how do we support that more. To your question regarding, you know, engagement and morale, I think I would say, Bruce, has been two key areas. One is communication. With so many workers being remote in the midst of such an unusual time, you know, it's communication. And so we really escalated our level of communication. So where we've had monthly meetings as a leadership team, we meet twice a week. And we use that opportunity to kind of connect on what's happening around the business. What are we seeing? You know, what should be, what are we hearing from employees and how do we respond? So those have gone to twice weekly meetings. We think about our regional managing director who used to do quarterly updates with the broad staff and let everybody know what's going on. He's now doing a weekly communication to let people know what's happening in our business around the globe and, you know, what are we experiencing in our own region and how we're responding. And so I think ramping up that communication and going from what I would say would be normal times, you need to go even more so. And even then, it's probably still not enough because we still have conversations from employees of that's great, but can we hear more about the strategy, or how are we going to move forward, and what's the future look like? So communication, I would say, would be the first piece. And then the second piece I think is equally as important is how do you continue to build community virtually? Because it's not as easy for me to get up from my desk and walk down the hall and have a chat with a colleague, or hey, let's go grab lunch while we're sitting together. You have to find other unique ways of doing it. So our teams have done, great things, from trivia game events to, happy hours, alcohol not required, breakfast meetings, coffee clutches, just ways to come together and connect as a team. And I've had one of my leaders here in New York who was excellent, did an Ask Me Anything virtual session where she just kind of opened it up and said, come ask me questions, let's kind of connect as a team. And on her first session, 50 employees showed up. And so it really became a robust way of how do you continue to build community. So for me, that's what we've been doing. We still do our pulse surveys. We have a quarterly pulse survey that we do with staff, and that's our way of understanding, are the things we're doing, are they working, are they effective, or what should we be doing differently? So that's what's helped us to try to keep engagement levels to the highest extent possible.
Johnny, it seems to me that one of the biggest challenges that we find with remote work is the fact that children are home as well, and that this remote work, I think, is presenting a particular challenge to parents, and within that group, even more so for single parents. What types of measures are you seeing clients implement in order to support those workers?
Yeah, I think that's a great question. And, I feel like many of us have probably had this experience over the last few months of learning a lot more about our colleagues than we ever thought we would, because we've met their kids, their dogs, their kids' dogs, and it continues, and we've sort of gotten used to it. But there is, definitely for employers, there is this thought of, what are the things we can be doing to support that? Do we need to be adjusting hours? And, going back to what Kiabi was talking about, I think, for many of us, some element of remote work or work after the end of the day has probably been a part of our lives for a long time. Many people are used to taking their laptop home at night and working for a few hours after dinner or at odd times. And so I think, part of it for employers has to be getting creative about how do we capture that? If that's a way that people want to work and they are being productive, even if we can't see them other than when we, webinar into them, how can we support people in that in order to help them feel productive? Because this is a weird time. I've had this conversation with many clients that, we've never had this experiment of everybody goes home for a period of time and has a sabbatical with their families. And, for some people that's great, and for other people it's a challenge, but, figuring out how to still maintain some good practice, still maintain some security about information. We're starting to see certain kinds of transactions and other activity picking up again, and maybe that's not something that the kids and the dogs and the kids' dogs should be, running through the background of, and how do you, set up a better way of working for that. But I think it's, initially a lot of it was people going to ground and not putting a lot of thought into it. Maybe we thought this would just be a couple weeks or 3 weeks. Some of these companies that are looking at a 2-year return to work plan are probably looking at, providing people with more secure setups, or thinking about how they can be more supportive. Some of it, quite frankly, may be about providing people with some kind of childcare benefit in order to, supplement when the schools are not available. How can we have our workers be more focused or have the attention that they need? And, to say nothing of families where you've got multiple levels of kids at different points of their education who all need to be remoting in at different parts of the day. Employers might need to invest in more bandwidth for all of those computer Zoom sessions to be running at the same time. So, this is sort of what we talk about at Littler as the next normal. This is going to be part of the normal for some time to come. And even if you're able to reopen in the states where you're able to reopen, we counsel every employer to build an element of reversibility into it, because even if it's just a short-term, exposure in the workplace, there's a possibility of having to go back again to remote. And this is COVID-19. There could be a COVID-20 before we have a reasonable solution to this. So being ready to go back and forth and building in remote work is going to be a part of it for the future, I think.
That brings us to a question that one of our attendees has raised. She asked about an issue that you spoke about earlier. And that is, if you do have health issues, what are the current guidelines surrounding employees submitting their private health data to employers? Can employees be required to subject to health screenings in the workplace?
That is a great question, and there's two different types of directions you could go with that. On the health screening issue, definitely a lot of the state and local orders that we're seeing include some element of symptom screening, which in most places can include having employees screen themselves. And we are definitely recommending, educating your workforce about the symptoms, what the most likely symptoms are. Some employers are even, distributing thermometers and the like to employees to make sure that they have the ability to check themselves for fever. But really encouraging employees not to come to work if they might have COVID, because it's a lot easier to contain exposure outside the workplace than inside the workplace. Some employers, particularly in healthcare, particularly industrial, have started doing things like temperature screening or even symptom screening. Temperature screening is tricky. It's just one symptom. Not everybody has it. You have to go down a long list of legal requirements in order to make sure you're doing it correctly. You want it to be safe. You want to make sure to address any pay issues, wage and hour issues that come up. You want to have a place to send people home if you have to send them home. And then you may need to contain the exposure because someone who was symptomatic came to work. So if you can get people to screen themselves, monitor for COVID, and keep themselves out of the workplace, that's ideal. And in many states, that is recommended or even required, that you set up a process for that. The other piece of health screening, we get a lot of employers who ask about testing, either diagnostic testing or antibody testing, or this week we're starting to hear about antigen testing. This is a tricky proposition, right? Because there still is not enough testing available. And because of the statistics of how many people we can expect to have infections, you need the tests to be more accurate than they are, more widely available than they are, and really faster than they are in order to get the kind of information you would need to make an individual level decision. So, if somebody tests negative, you kind of have to keep testing them every day. And it's an invasive test. It's not comfortable. It may not be something you want to introduce into your workplace. And the reality of the numbers here is most of your workforce is not going to be positive. That's just the statistics on who's infected. So if you want to invest a lot of time and resources in building a testing program, you can, and there are people who can help you do that. But the information that you get may not help you to do anything dramatically different with your workforce. You're still going to need a safety plan. You're still going to need to deal with exposure when it happens. And, other than self-screening, none of the tests so far that are currently available have been very helpful in containing this for employers. And you probably don't want to be in the position, if you've got a test that generates false positives or false negatives, of jumping into the middle of that and being the one who represents to an employee that they're positive or negative, and then have that turn out to be not true. So.
Excuse me, Kiabi, based on the email traffic that I'm seeing from our clients, I sense that there's a great deal of impatience to get back to work. And also, though, that there's a great deal of anxiety about getting back. As you think about your own workplace and the workplaces of your clients, where your employees are going to have to go to, as you mentioned before. What are the 2 or 3 things that you think are most important in terms of planning for a return to work?
Yeah, definitely. So I think the first thing I would say is define who is your essential worker. And that may look different, for different companies. For us, we said essential worker is someone who must be on a site, whether it's a job site or our site, to fulfill the function of their job. And so that narrows the playing field quite a bit, but I think it was important for us to define that population first and then start to think about, so what's the safety plan of returning them back? So for our client sites, we did put in kind of a process to say, who's going to have the conversation with, whether it's the contractor we're on a construction site or the lead client that we're working with, to understand what are their safety protocols for their site, so that we can ensure that our employees are safe when they're working there. And we've also done a lot of education with our employees to say, how do you raise issues? If you're not on a TNT site and you have concerns about, health and safety practices, who do you come to, or how do you raise that up? Because we still have an obligation to our employees. And so we've laid out those protocols, which I think are important. For our own offices, Johnny, we've done, similar to what you've talked about in terms of a self-assessment. We've decided we're not doing temperature tests at our TNT particular sites because, one, to your point, it's not always going to tell you whether someone's positive or not. And then you think about the risk of, well, who's taking the temperature? Is it someone standing there, you're putting them at risk to ask them to take temperatures of people as they come in? And so we decided we're not going to do that approach, but we are asking employees to do a self-assessment. So we've educated them based on, the CDC guidance that has come out. There's a great app that Apple has done around self-assessments. They've done in conjunction with the CDC as a way to assess yourself before you come into a site. So we've done a lot of work around that. And then we've talked about our own offices. So if we are going to look at when people come back, and we have not made a decision to open any of our sites at this point, but when we do, what does that look like? So occupancy levels, we're reducing significantly. Of course, we're not expecting 100% of the people to come back, but it's probably gonna be closer to 25% at most occupancy. We're looking at, how do you reconfigure your space? There's desks you're gonna take offline. We decided we're gonna close our kitchen. A kitchen is a great place to gather in good times and get together, not so great during a pandemic. So we're going to look at what do we do within our own space to make sure that our employees are safe when they return, and then educating our teams to say, this is where we are right now. And if you have to come back, here are the steps that we're going to take. Here's what we're going to ask for you to do. And here's what we're going to do to make sure everyone is safe. So I do think it is around defining your essential worker. It's definitely around what are the safety protocols, whether it's your site or if you're similar to us on another site, and really making sure people are clear on what that is, both employees as well as your leaders.
Yeah.
I'm sorry.
I was just going to say, Kiabi alludes to a really great point, which is, what we're anxious to get back to is what we left, but what we're actually going back to is not what we left, right? And I think it's one thing for those of you who are lucky enough to control your own space. That's one set of issues, but you may have to deal with landlord restrictions, property management companies, other employers at the site. General contractors, subcontractors, depending on which one you are, they may have a different plan than you have. We ourselves are starting to get communications from our landlords about reopening buildings that talk about, only 3 people will be allowed in the elevator. And so for those of you who are in New York, which I think is most of you, imagine queuing up in the lobby waiting for an elevator, which is after you have somehow gotten a subway to pick you up where you could maintain appropriate distance. And then you get all the way up to your workplace and you have to think about, okay, cleaning the doorknobs, cleaning the light switches. Bruce, you and I have been in the office late many times when the cleaning crew shows up. I don't think at any point in my entire career I've ever seen anyone clean a printer. That has never happened. But suddenly you've got to build all those things into your plan. And at a certain point, you realize when Kiabi referred to the kitchen, what we're used to, office lunches, people getting together, people taking breaks together, that is not the next normal. That is what we miss. That is what we so much want to get back to, but that's not going to be the reality. And, I think a lot of leadership teams are struggling with this idea of, it may be less comfortable for people to come back to the workplace, sit, very stiffly, counting off 6 feet, worried every time someone gets up to the printer, wearing masks. That may not be as productive as we're hoping. And so remote work, where it's possible, may be a better option than that.
Yeah.
So let me ask a question. You both have described in some detail some of the challenges that I think we're going to see in office environments. But I think a lot of the people who are attending our program today are in industries which are customer facing and who have to deal with members of the public. And I think those probably present some additional challenges. Would either of you like to comment on that?
I mean, sure. We had a great example this week of CEOs attending a specific meeting and being asked to take off their masks, right? Maintaining your safety plan, whatever your safety plan is, regardless of customer pressure or any other kind of pressure, is going to be really important. And we're seeing some unfortunate incidents here across the US in terms of customers who don't want to follow safety restrictions that an employer or a site has imposed in a restaurant setting, in a retail setting. That is going to be a cultural shift for people, I think. We're used to a mindset where the customer is always right, but I don't think that we can endanger ourselves or our employees in, carrying that out. And so, it's going to be difficult. Asking customers to wear a mask when they come in, or on a flight, or, at a table, these things are going to be hard. But the alternative is that people get sick and then you're shutting down again for a period of time. I saw a really creative idea this week where a restaurant had installed shower curtains around individual tables, so that effectively every table is in its own private island, and I guess the server, sneaks the food in through the gap. But some of it is going to be about creativity, some of it is going to be about patience, and some of it is about getting a better understanding of the science and what's tenable. But I think we always have to come from a place of respect, right? People have suffered real losses as a result of this. Economic losses, medical losses, personal losses, bereavement is a real issue. Yeah. And people are just having a difficult time with the change that they have to navigate. And so, trying to bring our customers along with us is important.
Yeah, I would add to that, Johnny. I agree with you. I think as employers, you have to make a decision of, how are you going to respond to those situations, and where do you stand in terms of the safety and the health of your staff. We're on client sites and construction sites, and we've had situations, especially in the beginning of the pandemic, where on a client site there was an employee who tested positive that was in close proximity to our team, and so the client didn't decide to shut that site, but we did quarantine our staff and asked them to come off the site and work with work with the customer community, work remotely, and we worked out. So I do think it's going to be difficult. It's very hard to navigate that, but you're going to have to understand, where do you want to stand as the employer, and what are you going to do to protect your staff, because that is still ultimately your obligation to do so.
So one of our listeners asked this question, which I think relates directly to what both of you are talking about. Legally, there is still no guidance from government officials about social distancing, face coverings, and the liability of employers to comply. If I provide a poor face covering and an employee contracts the virus, am I liable? Are my clients?
That is a great question. So I think there's a few different levels here, right? The employer has an obligation to provide a safe workspace under our occupational health and safety laws, OSHA, and the employer also is well advised to have a safety plan that is specific to this particular situation. And while it's true that there aren't centralized guidelines, there definitely are state level guidelines in terms of what seem to be the best practices. The challenge again is going to be, in those places where there are no guidelines, what do you do? my advice has generally been, if you're operating in some locations that have guidelines, try to follow those guidelines. Your employees in Florida will speak to your employees in Ohio, whether directly or by Twitter, and they will figure out that you are capable of providing some safety measures. In terms of the poor face covering, I mean, that is hard to deal with. It's sort of like any situation in which you are providing safety equipment. The expectation is that the safety equipment is fit to purpose. And this is sort of one of those where I encourage people to remember how we used to do things before this immediate crisis happened. What would have happened before if you provided employees with tools or equipment or, protective gear that did not work. Most of the time, the answer is going to be our workers' compensation system. If an employee can actually show that they got sick at work because of work. But again, this is a pandemic. We have community spread. So I would not assume necessarily that, an employee will automatically be able to say, well, work is how I got this. Because it could also be, unfortunately, somewhere in the community as the source. But the workers' compensation system was developed to try to help employers field this issue. And I think that is generally going to be what the recourse is.
Kiabi, what about the idea of sort of these conflicting guidelines that that Dejani alluded to, that the guidelines are not the same every place, and that employees in one location may have questions about what you might do in another location? Any thoughts about that?
Yeah, so how we approached it is we looked at, what is the science telling us? What are the, guidelines coming from the health authorities in terms of, how best to re-enter an employee to a work site, or how do you want to manage your work site when you're reopened? And so we've set minimum guidelines for all of our offices to say consistently, no matter where we are, this is what we're going to do in terms of occupancy levels, in terms of, how we're going to configure our space, in terms of how we're going to get, health and safety plans for the various sites we work on. And so from our perspective, that does work consistently across. There may be nuances in markets where, there are some, where we're saying 25% occupancy, for example. There are some, states that are saying 50% occupancy is just fine. And so there may be nuances where we need to flex our guidelines for a particular market, but we haven't found it yet. We have found that what we put into place can consistently be done across all markets, and it's reasonable, and it's really based on, what the health authorities are sharing for us. So that's how we've approached it within our business.
So I just want to stop briefly and remind everybody that we are going to be taking questions, and this would probably be a good time for you to be thinking about typing them into the question and answer tool that we have at the bottom of your screen. There's another one here that I think is very pointed to what we're discussing right now, and that is our questioner says, you've spoken a lot about anecdotal evidence, but how can organizations fully understand the challenges their employees are facing? What are the best strategies to collect data from your employees? I'll leave it to either
one. So they're saying, if I understand the question, they're trying to understand how do we know specifically how employees are faring during this time or what they're experiencing. So again, I had mentioned earlier, we have a quarterly survey that we are continuing to do. What we've done in this particular quarter, given the pandemic, was to add questions specific around the pandemic in terms of our communication, in terms of employees, being able to work remotely, in terms of, how any challenges employees are experiencing at this time. So we just enhanced that survey, but it's pretty robust. Normally we have about an 88% response rate at the end of 3 weeks. We had an 87% response rate after 3 days, given where we are. And so employees are very engaged. We got a lot of robust data, but that's how we kind of find out from our employees directly. And then of course, the connections that our leaders are having with their teams and asking them to feedback any issues or concerns that they're hearing from their staff.
Johnny, any thoughts?
I think that's right. I mean, surveys are great. I think communications on a regular basis are so important. This isn't a set it and forget it kind of thing. Our own organization has been doing town halls to push information, and our leadership has been very visible. They're always very visible, but joining individual team calls and being accessible for questions. I think the other piece of it, a couple other pieces of it. One is you want to make sure that you've built some feedback into your planning, because there are going to be people who understand jobs at a level that the leadership may not, right? And so part of, we took 2,100 attorneys and staff remote. We could not have done that without some robust representation from our IT colleagues to say, we're going to need to buy Chromebooks in order to get them to our employees who don't have laptops so that they can stay connected. So sometimes it's not necessarily the people you think will have the most to contribute who have the best insight about what needs to happen. The other piece of this is that you probably have access to data that you're not taking advantage of. So a big part of our return to work planning is looking at what is the use of public transportation in our offices, because these are folks who are going to face a different challenge getting back to work than people who can just drive themselves in their own car and arrive less dependent on scheduling and other factors. And that is going to be part of figuring out which office is open in which order. Again, some of the stuff is going to be site specific. Your landlord is going to tell you how many people can be in the elevator, unless you think it's just a tall building problem. I worked for many years in a building that was only 2 floors, but had all these revolving doors. So take all the issues of elevators and just transpose them to the line outside the revolving door in the rain, waiting to get into your office. And, to anticipate the next question, no one knows how you clean a revolving door, maybe with robots. So
let me ask this question, Kiabi, how do you motivate employees to come back to work when they fear getting infected, which is a reasonable fear? They have childcare issues, which they do, and many of them may be getting more on unemployment with the federal supplement than they would be earning if they came back to work. So what do you do to get them to come back?
So for me, I think it's how do you embrace more of an agile working environment? Because I think getting back to work implies that they have to come to an office, or they have to come on site, or they have to leave their homes in order to be productive. And I think because we have found that people are productive remote, people are productive at home, and they're balancing that, of course, with children at home. I have 2 remote learners at home, and I'm their unpaid teacher assistant at times. So I understand, the experience of trying to work remote while you have children learning. And so for me, it's less about, how do you get them back in the office, but how can they be productive where they are? And if you're finding that people are productive in remote working environments, then keep going at it, right? I think some employers looked at this in the beginning as this is a short-term gap or a short-term measure to get us over the hump of, what was such an unprecedented time. But I think the reality is this is really going to be a long-term strategy. And how do you embed that into your ways of working as a business? I think that's how you do it, because if I can work remote, then I can deal with my childcare issues. I can deal with, my fear of not, taking mass transit to work. I can make sure I'm healthy and safe because, I have concerns about my own health conditions. All of those things kind of go away to some extent if you can make that happen. And so that's what I would say for most employers. Think about how can you embrace this and really make it a part of your fabric versus resisting it and saying this is really something short term that I'm hoping we can get over soon, because that's just not going to be the reality.
Johnny, any thoughts about that question?
Yeah, I mean, I think, it's interesting because we're approaching mid-year review time. And I think we can all acknowledge that 2020 is not going according to plan, unless you had this plan, in which case I want to be listening to your webinar. But, there is this sort of need to recast how we think about engagement. And for a lot of people, quite honestly, remote work, isn't all it's cracked up to be, and they are struggling with it. But I think we've got to be creative about finding ways to keep people engaged, keep people motivated, provide support to people. And again, to Kiabi's point, doing these surveys, really reaching out and listening is so important. These are very important very serious issues that people are dealing with, and coming from a place of respect and openness to have the conversation where you can is going to make a big difference to people wanting to come back. I mean, what's the alternative? Stay on unemployment for the required period of time and then go try to find a job during a pandemic? Probably not for most people.
Yeah, but I am thinking again about issues for where remote work is not an option. I mean, there are so many jobs that, you know, cannot be done remotely. And I think, you know, often those are the people who have to come to a, you know, to a store or to some kind of facility where they are going to be interacting with the public. And
yeah, that's a fair point. And I think in those situations, I just keep coming back with our clients to the safety plan, right? The safety plan and communicating it and very clearly laying out, here's what we're responsible for, here's your part in this, here's what makes it reasonable for us to ask you to come back and be part of this. And again, you know, many of us are operating a little bit in the blind. Maybe we're in states that don't have really detailed guidelines, or maybe we have to make the best compromise we can with the guidelines. But showing employees, we have thought about this, we have thought about the work you do, we have upped our game in terms of protective measures. That's what makes it reasonable. You know, and the hope is that employees see that and understand it and understand that part of it, and that there is, again, that opportunity for them to weigh in and raise the issues that people may not have thought about. But yeah, fundamentally, you know, it's going to be a heavy lift, but I'm confident that employers are creative enough to find a way to carry it.
And I would just add to Johnny, just and educate, right? So it's one thing to create the plan. It's totally different in terms of make sure you're communicating that plan to your teams. You know, have all employee meetings, have team meetings, talk about how we're going to make this work. So I think the communication point in terms of how you disseminate that information to your employee population is equally as important.
So, Dejani, you had mentioned, you know, it's sort of mid-year review time, and one of our listeners asks, how should companies approach restructuring performance-based compensation for employees whose jobs have been affected by this crisis?
Carefully and in partnership with your HR and employment counsel.
Yeah.
No, that's a great question, and we are walking through it with a lot of our clients. If you've got commission plans or folks who are heavily measured based on production, you know, the second quarter of 2020 is not great, and the third quarter maybe only slightly less not great.
Yeah.
So you do kind of have to look at, well, what's being expected? You know, for some environments, there's the opportunity to do things like virtual sales calls. For other environments, there may not be. And there may be situations where certain job functions don't have a lot to do at this period of time. You know, if they're being measured based on events planned, you know, unless you can do everything in a format like this, you know, those event planners may have less to do. Those customer relations folks may have less to do because customers aren't engaging in the same ways that they were before. So I think, you know, this period of time is the period when you should be looking over all those plans and figuring out, you know, is this still a function we want to have, and how should it be compensated? Maybe you move people from a commission basis to a salary for some period of time because you want to retain them. You don't want to lose them all and have to re-onboard them later. But it will be highly specific to the industry you're in, the kind of company you're running, and what your product or your service is as to how you manage that.
Let me ask you a question. Let's diverge a little bit in a different direction. We only have a few minutes left. Do diversity and inclusion programs now take a back seat to, you know, COVID response and planning, or do they move to the front as we see, you know, sort of greater levels of mental illness in the workforce, varying work situations? I mean, how do we approach those issues?
Yeah, I mean, so it's interesting. I think, from my perspective, I think in the midst of this, everyone was heads down dealing with the pandemic, and all resources and all energy was just focused on, how do you maintain that? But if you're going to think about, the recovery part, and I think that's the piece that organizations need to start focusing their sights on now, because we are where we are. We're continuing to manage the best we can, but you think about where the future of your organization is, you're going to have to start thinking about your diversity and inclusion focus areas. You want the most innovation at the table when you're dealing with the pandemic, and really thinking of how do we think of solutions that are going to address our needs going forward. So I think it becomes, even more important. I think we probably lost some traction on it in terms of our area of focus for the last few months, but I think in reality, it's going to have to be a refocus on it, given if you want those creative solutions coming to the table, you're going to have that as part of your agenda and conversation.
Yeah, I think if ever there was a time for out of the box thinking, it's now.
Yeah.
We've certainly seen in kind of past economic downturns that D&I took a hit, or that, people, this is where you want to make sure you have good, strong outreach communications, to the extent that you have mentoring programs or affinity groups that you call on those, because those can help hold your organization together and provide support. If you're only counting on informal efforts of people reaching out to people, your D&I might suffer. And I think, as we get into the substance of what the questions have been, it's so important to have your inclusion principles first and foremost. We get clients asking about, can we just send home everyone over the age of 65? No, you cannot do that. I have clients who ask about childcare, but somehow they're only ever asking about men who need time for childcare and not women. Like, those are red flags that the program's not working and that your principles of inclusion need another look, that you need to make sure you're following all the good rules you put in place when we weren't dealing with the coronavirus, which I know sounds like ancient history at this time, but those issues will continue to exist. And being able to deal with them is going to determine how strong your organization is coming out of this. Not just your business, but your actual team.
We have only a couple more minutes left. Any final thoughts from either of you?
We covered so much. No, I mean, I think here's what my thought would be. At the end of the day, I think there's been so much focus on, what, we've lost as businesses, in the midst of the pandemic. And I think now the focus should be, what have we gained? What are the new opportunities, whether it's new lines of work, because there could be new lines of work and service, whether it's ways of working, whether it's, how we've connected as a team in more creative ways than we've done before. I would just say, let's not lose that. As we think about recovery and moving into this next phase of, Johnny, like how you said, the next phase of new normal, and bring along those things that we've gained that were the positive in the midst of all of this.
I mean, I think, look, we've all been moving at an extraordinary pace. I think early on, people had some idea that, oh, well, I've got to work as hard as I can now because this is going to stop. It seems like this is not going to stop. But I think, taking some time to just reflect and figure out who you are as a culture, as an organization, and who you want to be is the most important thing. It seems apparent there's not going to be a central fairy that comes down and says, here's what you have to do. It's all wrapped up in a bow. You're going to have to find that package and you're going to have to make your own bow. But remembering who you are as your guiding principle through this is really the best advice I can give.
Thank you both. Tamara, any concluding remarks? I think I surprised her there.
Just a very big thank you to you, Bruce, Kiabi, Devjani. That was really very helpful. The session was recorded, as we mentioned, so for anyone listening, if you'd like to pass this along to colleagues, please feel free to reach out to us. And likewise, I'm sure that all of our speakers would be happy to connect on a one-on-one basis if you do have any follow-up questions. So with that, we're right at the top of the hour. Thank you all very much for joining us, and please join us for the next session next week. Details to follow.
Thank you so much.
Thanks.
Great.